So we've put together a lower back pain protocol. This is a series of exercises that can be done at home with very little equipment, and they're essentially for most generalized lower back pain. So I think that most conditions that we see in clinic would be appropriate for this type of exercise program. It's not too testing, but it's still effective enough to have some positive effect. So it consists mostly of myofascial release, which is essentially self-massage techniques used to release tight, tender, painful tissues. Should give you some immediate, nice relief, and then it should, in the long term, create healthier tissues as well. Then we're going to do some kind of refined stretching mobility things on key muscles that are often involved with low back pain and some postural issues. And then we're going to move into, once we've kind of broken down the tighter tissues and gained some mobility, then we're going to try and build things up. So we've kind of broken it down, then we're going to build it up. So we're going to start with some basic entry-level core strengthening. This isn't the be-all and end-all, and you can definitely advance it further if you wanted to, but I think it's good to have that nice baseline set of exercises that you can rely on, that get you some relief, that maintain your mobility, and hopefully boost you into being a little bit stronger in the long run. So hope you enjoy it. If you have any questions or queries, let me know. Let's get started. Okay, so exercise number 1 is lacrosse ball myofascial release for the lower back. So this is a lacrosse ball. It's a lot harder than a tennis ball, but the same size. So happy for you to use a tennis ball if you're a beginner, or if you don't have a lacrosse ball. Cricket ball also works. A golf ball would be too small in this case, but a lacrosse ball is the best tool if you can. Sometimes you'll find those spiky balls as well, which I'm not too bothered about what you use, as long as it's a similar size and similar kind of hardness. So we're going to put it in the lumbar spine. If you just have a turn around on, just from behind. So we're going to go, ideally what we want is, we've got the spine that runs central down here. We're not going to go on the bones, so there's no real benefit of that, and it's probably just going to make it worse. So you're going to go either side in these paraspinal muscles that run down your spine. If you've got 3 columns, this is the spine, and then these are the 2 muscles either side, that's what we're on. So we're in these muscles in here. We can do it all the way through, but in our case we're just going to focus from just underneath the bottom of the rib cage and then to around the top of the pelvis. So in this area we're going to come in about here, just into this pillar of muscle, coming in at about 45 degrees, and then we're going to hold it. So we can do this against the wall, we can do it on the floor. So let's just try against the wall. Man, if you put it in your right side and then have a lean against the wall and try and get the pressure in the right point. Let me just check that that's in the right area. That's right. So she's about right side, so she's about here in the spine, just coming. This is the central bones, but just on the muscles, and we're coming in from the side. She's going to fidget around until she finds a tender area. Just let me know when you found a tender area. Yeah, feel it? So once you've got that bit that feels a bit uncomfortable, just hold the ball on that area. So we're just going to keep it there as minimum 2 minutes, up to about 5 minutes on any given tender point. She could, if she wanted, just have a little nudge. So just once she's on the area, just nudging forwards and backwards, just trying to. Sometimes I will kind of just bounce on the knee and just get a little bit of a feeling like you're massaging into that point, just like a teasing massage on that point. We can work through the right hand side, then we'll do it on the left hand side, and then we'll move on. I'll show you now how you can do it in the same area but on the floor. So we've got the ball set up now in this position in the lower back. You can see it just under here. With this exercise, if you bring both, it's the same exercise but just lying on your back. If you bring both legs up and tilt your legs out rock your legs out to the left so that your pelvis comes totally away from the floor on that side, we should be able to take our weight completely off of the ball at this point. And then, if you keep your legs together, if you just roll them back until you start to feel the pressure come on, and so we can go from 0%, and the more we roll to the right, the more we'll feel the pressure in that area. Once you've got it in the right point, feel around for it, find the tender point, hold it. You can have a little nudge forwards and backwards. You can stick just on that point. Maybe encourage some breathing as well. Have a big inhalation in, all the way out. Big inhalation in, So once you've got that tight tender point, then you can work around it in multiple ways. You can hold it static, you can nudge it around, or you can incorporate some kind of movement. In this case, we did movement of the rib cage, so breathing in and out. Okay, we move on. So the next exercise is myofascial release for the side of the hips. This is not in your lower back now, but in these muscles at the side of the hip, just below the pelvis. So this is your glute med, glute min, side of the pelvis, glute muscles. So the way to find these areas, if you get your hand and you press on your ribs, just have a go, man. If you feel your ribs here and poke them, and then you keep coming down, you'll find that it goes soft again. It's where your ribs are finished. And then if you keep going, you'll find it gets hard again. And that's your pelvis. That's the top of your pelvis. So that, imagine the rim of your ear. That's the top rim of that ear. From that point, if you drop down into those tissues, that's your glute fibers. From the top of that iliac crest at the top of the pelvis, right down to, if you hit the side of your leg, you'll feel a hard bone sticking out here, and that's your greater trochanter. That's the side of your hip. So we're not going to go that far down, but just in this band here, if you use your belt as a guide, it's just below the belt buckle, it's just behind the pocket, it's in that zone. So popping the ball there, and then we can do it, I would advise doing it against the wall. So we're taking in against the wall, find dead side on, find the tender point, have a roll around, then we can move around 45 degrees. We can move, it's going to be pretty painful. Move around further, we can move around further. We can even go slightly round to the front, just in this area here. So the way to find this is if you put your hands on these two front bones, just have a feel for those two front bones. Two front bones on the front of your pelvis. And if you come down about 2 centimetres and out about 2 centimetres, so down an inch and out an inch, you'll find a tough bit of tissue. Just unhook your legs. So find that bone there, then down, and then here. And if we press into here, you'll find that it's really, really tender and tight. So nice little point just there. It's about where the pocket is. And with that one, we just have to turn straight into the wall like that. Really nice way of getting some release around the hips. So we move on to the next exercise. Okay, the next exercise is a kind of a pelvic tilt in all fours with some abdominal hollowing. So let's move straight into that position. If you go into all fours, man. That's it. Slight gap between the knees, and shoulder should be about 90 degrees here. And we're going to come into an angry cat to start with. So if you tuck your bum right underneath you, an angry cat or a posterior pelvic tilt, bum tucking under, rounding in the lumbar spine. From that point, we're going to draw the belly in, so pulling the stomach in as if it's being pulled from behind like a drawstring. Keep that drawn in, and then try to move the pelvis through range really slowly without losing that belly being drawn in. It's quite a difficult exercise to do. And what you'll find is it's very easy when you're in the beginning position, but as you start to roll forwards from the pelvis, it's harder and harder to keep your belly drawn in. So just come back into that posterior tilt all the way. Yeah, good. Belly drawn in. Hold your belly in, and now start to come into a forward tilt of the pelvis. Nice and slow. Don't lose that tension. Keep your belly drawn in, all the way. You might start to find it difficult to hold on to it at that point, and then come back, keep the belly drawn in. That's nice and easy. Belly drawn in, and then come back into the forward pelvic tilt. Nice, okay. Essentially what we're trying to get is we're trying to differentiate the pelvic tilting and the abdominal engagement. So one of the things that we find, if I tell Monica to pull her belly in, she's actually very good. There was almost no movement in the lumbar spine. What most people will do, if I tell them to draw their belly in, they will automatically do this and posteriorly tilt. So they'll pair both. And really we should be able to isolate each individual component. So that's what we're trying to do. Move the pelvis through range whilst engaging the abdominal muscles, trying to differentiate those two actions. Okay, so we're going to move into a lying spinal twist. This is a really easy relieving exercise for almost all back pain. We're just going to lie on the floor and take a leg out to the side, and it opens up the joints of the lumbar spine, stretches some of the smaller stabilizing muscles and ligaments around the spine. Pretty good for most conditions, whether they're old or new. There's usually some level of tightness around the joints of the spine. So a nice simple exercise. I'll show you how to do it. So this is the lying spinal twist, where you go laying flat with one leg down, one leg up, and we're going to come towards the camera, and so we're just going to take the hips a little bit more, just shuffle them the opposite way. And what that means is when this leg comes over, as we do now, we're twisting around a central axis. We're not shifting way over, so the spine is staying pretty straight, it's just rotating. From that position we should feel a nice stretch. We can keep the arms flat on the floor. We can straighten this leg if we like. We can take this leg out to get more of a tension through this line, which will bring a bit more of a pull into your back. So next exercise is a glute stretch in laying on your back like a number 4. Essentially, a lot of the time with lower back pain, you'll have some referring tightness into the muscles around your buttocks, around your glutes. Whether that's the result of a nerve irritation or whether that's a mechanical compensation that's happening for the issue in the lumbar spine. So usually you will find some kind of tension in the glute. Now, I'm not a massive fan of some of the deeper combined stretches of the hip, and similarly stretching of any kind that's really taking the joint right to the end of range and creating a flaccid floppy joint. But I do think with this exercise it's quite a simple, easy exercise that gives you a good amount of relief quite quickly, and it's not going to destroy your hip socket in the process. So nice simple exercise that we can perform to give you quick relief. So let's have a go at that. If we take this leg and pop it onto the opposite side and just bring this knee down towards me, that's it. So when we look now, we should see almost like a number 4. If you then reach through, grabbing the back of this leg with both hands like that, so you reach through the hole with your left arm and your right arm comes to grab, and ideally if you can lock your hands together either here, or if you're flexible enough you can grab this bit here. That's it. Relax your head down. You can have some pillows with you if you have more of a curve in the spine. The more you pull this up, the more of a stretch you're going to get in that side. So this is stretching the left glute in here. Perfect. We hold it for a certain amount of time and then we repeat on the other side. If you don't want to hold it like that, or you're struggling to keep your head, you can relax down. If you're struggling to keep your head up in that position, you can just get in this exact position and then put your foot against the wall. So the wall does all the work for you, and then you can chill out in that position for quite some time. And the closer you shuffle to the wall, the more and more you're going to feel that stretch. Some people will struggle to come any higher than this if they're very, very stiff. So if you can get your ankle onto this thigh, then what you can do instead is just use your left hand to push the knee down to get a bit of relief in there. Sometimes you can even direct that pressure into the hip, so you can push and distract from the hip socket. If you're struggling to get the leg into this position, so then the best means of getting a stretch might be just to lift up and just to pull, using your hands if you grab on this side, just to pull up as far as you can take it to try and feel a stretch into here. So we're going to teach a iliopsoas or a hip flexor stretch in kneeling with a side lean. The intent with this is to stretch some of the deep muscles at the front of the hip, particularly psoas and iliacus, and possibly pectineus, some of the deep front hip muscles, and also to open up some of the side muscles in the lower back, and hopefully the combination will give you some nice relief. A lot of people with lower back pain will feel pain to one side, and if they feel around these muscles to be very tight and painful, and a lot of people will be in this forward tilt of the pelvis, and so they're a bit shorter in the psoas muscle, because the psoas, if you imagine these two muscles at the back of the spine, the erector spine, these two pillars of muscles that you can see, imagine another set of those underneath them, deep to them, on the front of the spine that we can't get to, and they insert there on those side of those vertebral bodies and then come down into the front of the hip. And so when they're short, they tend to pull us into the forward pelvic tilt like that. So, and that's quite a common position. The issue with that is that it then jams the lower back. So if we can stretch the psoas muscles, then we might end up freeing off the lower back. So this is a nice stretch, for a really powerful stretch for the psoas, for the iliacus, and then some of these smaller muscles in the side and in the rib cage. So the way to perform it is to go kneeling on one knee and the other knee forwards. I don't really mind where this left leg is, it's just there for balance. So if you need it to be a bit wider or a bit further forward, then that's fine. Sometimes people will feel a bit of a pull through the kneecap, so you can pad the knee out with some pillows if that's more comfortable for you. Then we're just growing tall, nice and tall from the spine, nothing too major, just a nice tall, good posture. From that point, we're not just going to drive your pelvis forward. So that would be a forward shift of the pelvis. That's just bringing the weight forwards. And that, with time, will bring a bit of a stretch a bit further down into the quad muscle. We're not going to do that. So bring your weight back over your knee. And then we're just going to start with a posterior pelvic tilt. So that's to flatten your lower back. That's great. Yeah. Flattening this bit here. Bum tucks under. Flattening the lower back, and what we should feel in that position straight away, without having to shift forward, we've just tilted backwards, we should feel a stretch at the front of the hip in here. Can you feel that in the front of the hip? Mm-hmm. Yeah, so we go belly drawn in, tucking your bum under, and you should feel, just show me where you feel it. Yeah, somewhere in there. So it should be in this kind of top third, sometimes as far as kind of midway down, but it shouldn't be right down towards the knee. It should be a real feeling like it's higher up. Then we can make it a little bit more advanced. So keep the belly drawn in, keep the bum tucked under. Can you still feel that stretch? Mm-hmm. Keep the belly drawn in and then try to elevate from the rib cage and see if you can just chase that feeling of a stretch a bit more. And then maybe even just add in a slight side lean to the left. So now we've got psoas, but psoas inserts onto the lumbar spine, onto the side of the lumbar spine. So if we take the lumbar spine away, we start to stretch it even more from the lumbar spine. So, and then if we want to go all in, then we can take this arm, bisecting through the ear, pinky up towards the ceiling. Not at the loss of everything else, so this is still on, belly drawn in, posterior tilt, this is elevating and pushing out. If I put my hand on here, I'm going to try and get Monica to push her ribs out into my hand as much as possible, project them out, maybe have a big deep breath into that and try, that's it. And you should feel a nice stretch through these side muscles. So we've got psoas, but we've also got these side muscles, the rectus spine, QLs, obliques, some of the intercostals, we're even coming into lats, through the posterior cuff, and a real nice combined stretch for a whole chain of tissues, deep tissues within the spine. So hopefully you'll gain some relief from that. We'll move on. So the next stretch is a hamstring stretch and also a hip hinge. So it's teaching two things. It's stretching the hamstring, but it's also teaching you to hinge from the back, from the hip, sorry. So not from the back. So I'll show you and demonstrate what we mean. When we bend forwards, what we don't want to see is this rounding from the lumbar spine here. That puts a lot of pressure on the lumbar spine tissues and onto the front of the disc in your lower back. So what we can do is instead keep the spine in that neutral position and then just hinge down from the hip. So that would look not like this, which is rounding from the lower back, but more like this, where we're hinging from the hip, coming down. You will come to a certain point when you start to feel a stretch in these muscles at the back of your thigh, the hamstring muscles. If you imagine when someone stands, a lot of the time we stand in this kind of bowed position, forwards. If you imagine these muscles tend to be longer, in that imagine it's like a bow, and this bow, the muscles here will be drawn out and these muscles will be shorter. And you can imagine where the arrow flies is where the compression is, and that's why there's a lot of lower back pain with that kind of posture. And this is 90-something% of clients that come through the door. So most people will have some shortness in the hamstring or some shift in the pelvis forwards. So we're going to stretch the hamstring. Most people will stretch the hamstring maybe like this, or in a laying position, or at worst kind of bending forwards. We're going to do it slightly differently. So I'll get, I'll do it, and then I'll get Monica to have a go as well. So from the side, we're going to bend the knee just a touch, and then we're going to sink down and just put your hands on your thighs. So just have a go, man. And just go side onto the camera. That's good. That's it. So that's it. So just come and rest on your thighs for now. We're not going to keep you there. So this should be easy at the moment, but as soon as we take Monica's arms off of there, she's going to feel inner quad muscles in here. So it's like a squat essentially at this point. You want the legs about hip width apart. So a little bit closer for you. That's it. That's perfect. And then we're going to sink down, put your weight on here, and then take your arms off. And then just take your arms off. That's good. That's nice. And then we're just going to take the knees backwards until we feel a stretch in the hamstring muscle. So let me know when you feel that.
I feel that.
You feel that? So she's taken the knee back. She's not come up from here. If you've come up here, we need to hinge down further from the hip. In this position, we should see that the spine is nice and straight. We shouldn't be burgeoning outwards. Can you just burgeon outwards just so that you can demonstrate how it shouldn't be done? Like that. That would be rounding in the lumbar spine. Can you go the other way? That would be the better way to be in. So that anterior tilt. Stick your bum out, belly drawn in. You should feel an extra tug just around here, just around the hamstring insertion in your glutes. You should have this stretch through the hamstring anyway, but you should also be able to get that extra little tug from up there. Hold for 30 seconds. That's nice. Keep straight in the chest. Just lift up a little more. That's nice. Knees back till you feel a stretch. That's good. You can also often get this shaking in this position. 30 seconds and then come out. That's it, and take a break. So what we're doing is we're stretching the hamstring, and we're also teaching you how to hinge from the hip. That takes away the compression on the lumbar spine, and that mobilizes, it increases the length of the hamstring. The benefit of that is that when you now go to bend forwards, when you have the short hamstring, when you bend forwards, you're not going to bend from your hip anymore because the hamstring is tight. So you're going to choose the next joint up. The next joint up is the sacroiliac joint, but the sacroiliac joint doesn't move much unless you're pregnant. So it's going to move from the next joint up from that, which is going to be the lower back. And that's why just stretching the hamstrings alone can rid you of back pain if the hamstring tightness was the issue, and it quite often is. So nice little thing to just include. If you're finding that you're coming right down, right here, and you're getting your legs fully straight, then your hamstrings have enough length. So this exercise is not that appropriate for you. So move on. And now we're going to move into some basic core strength work. You'll find this on the core program that I did previously. But essentially these are 3 exercises that come from a guy called Stuart McGill. They're known as Stuart McGill's Big 3 exercises. It strengthens the core muscles around the spine, from the front, from the side and from the back. So it's a nice all-round set of core exercises with a good evidence for their effectiveness. So let's move into the first one, which is a side plank. This trains these, just hang on for a sec, this trains these side muscles in here, the oblique muscles. So if you have a lift up from there, this is from the knee. At this point we should have the elbow stacked under the shoulder. The pelvis is facing directly forwards and the chest is facing directly forwards. We're not tipping backwards or forwards. We're just holding directly, facing towards the camera, belly drawn in. And in this case we're doing it from the knee. That's the easier version. We can also do it from the feet. Could you demonstrate that? If you're doing it from the feet, I usually say have one foot just in front of the other, and that'll give you some nice balance, and then hold it. If you want to make it more difficult, you can dip the pelvis up and down like that. Perfect. And we'll move on. Okay, we're going to move on to the second core exercise, which is a static abdominal contraction. This trains the front muscles in the core, rectus abdominis muscles. If you imagine this is like a Union Jack flag, you have vertical muscle rectus abdominis, or the six-pack muscle. You have the deeper transverse abdominis muscles, and then you have the diagonal oblique muscle. So this is training the front, more superficial rectus abdominis. So if we lay on the back like that, just shuffle down a little bit, man. That's it. We go with one leg flat to the floor, one leg up. if we take the left hand and just pop it underneath the lower back, this prevents the lumbar spine from flexing forwards, which takes any pressure off of the disc. If you had a disc bulge, a nice option just to pop your hand under there. From that position, if you just lift up, taking the bottom of the sternum or the bottom of the around where the bra strap is, or the bra is, and then into the belly button, so you're shortening that distance there. It's a contraction of these abdominal muscles. Just hold it, it's not a sit up, so you're just holding there, squeeze for 10 seconds, really squeeze, you should feel it really shaking in there, and then relax, and then repeat that 3 times. So just have another go when ready, lifting up, squeezing in here, just take some of the tension out of the neck if you're feeling it in there, hold for 10 seconds, really squeeze, and then lower back down. Nice simple contraction for those muscles in there. Okay, so the third and final core exercise from the McGill Big 3 is a Superman exercise. So this is in all fours, like a Superman, left arm, right leg. And now we're going to train some of the smaller stabilizing muscles in your lower back. So the muscles of multifidus and rotatories that insert around the joints in your spine. So the way that we're going to do that is go into all fours. So if you can go hands and knees. And the most critical thing with this is that we have a neutral spine and a neutral pelvis, and we're going to hold that position throughout the whole movement. So starting position, 90 degrees at the shoulder, 90 degrees at the hip. We're going from the wrists, not the forearms. So with the plank we were going from the forearm, this is from the wrist, and the spine should be dead straight through here. So the way to find pelvic neutral is to go into a full posterior tilt, a full anterior tilt, and then find the kind of middle ground. And when we look at the spine in here, we should see that it's nice and straight. It doesn't burgeon outwards or dip inwards. From that position, just draw the belly in. Don't posteriorly tilt when you draw your belly in. So what you'll find is if you draw your belly in, you'll come into this angry cat, and we don't want that. So slight neutral position there, belly drawn in, but don't see any movement in there. That's perfect. Some of you will be rounded in here, so if you drop your shoulder blades down a touch, Monica's in a fine position as she is. Okay, so from that position, we're then going to hold this stable. Imagine if we take something like a pot like this. You could use a tennis ball, or you could use a pot like this. Balance it on the pelvis, and then try and keep it in that stable position whilst moving a limb. So we're going to hold there. Can you take your right arm straight forwards without moving at all? Easy. That's not going to be hard for anyone. And then take it back down. Nice. Then let's try the left leg only. I'm going to take it straight back. That's it. That's really nice. We can take it back about 50% of the way. We can take it back all the way. What you will find is, if you just take a break, what you'll find is as you take the leg back, you will want to shift your weight across to the opposite side. So as we remove the base of support on the left, we're going to want to shift the center of gravity across to the right to cheat. So let's try not to do that. So if you draw a line through the center of the chest, down on the floor, midway between your hands, don't shift across from that side. So we're going to take the leg out behind us into extension, but we're going to keep the weight central. That's nice. Not shifting across towards the mirror. Just go back again into that position. So as we take the leg back into extension, that's nice. Now we're thinking about what's happening in the pelvis. So we should see that the pelvis stays neutral. It doesn't rise up on one side, it's staying there. We can tuck the bum under a little bit and then try to extend the hip. And this is really nice if you can do this. So you're trying to flatten the lower back as much as possible whilst extending the hip back. And you'll find this biting point where to take this back any further, this will dip down. And I want you to try and fight in that position. When you get it right, you should feel it in your glute muscles. The hip should be rotating down, the foot should be pointing. But most importantly, the pelvis is staying in that stable level position. We're not shifting across to the side. The pelvis is directly facing forwards. That's perfect. Then you'd come back down. The more difficult version is to go left side with right arm. So we would do alternating or opposite limbs. So just have a go at that one. Belly drawn in, keep this stable. Left leg, sorry, with right arm, spine dead central. Can we tuck your bum under more? Can we extend your hip more? That's nice, perfect. And then back down. Reset. Make sure everything's in line. Belly drawn in, pelvis in neutral, and then we go on the opposite side. Okay, that's the third exercise for the core strengthening, and that rounds off the end of the whole program. So I hope you found that to be beneficial, and give it a go. Let me know how you feel with it, and if you need any advice, just let me know.